Hi, I'm Jenna, and I am the graduate clinician who will be conducting your voice assessment today.
Hi, Jenna. I'm Travis.
Hi, it's very nice to meet you, Travis. Thank you for coming in today.
Thanks for having me.
So, we are going to start out the assessment with a client interview. And I'm just going to ask you some questions about your medical history and your background just to get a better idea of why the voice disorder might be happening and how we can help you in treatment. Okay. So, Travis, how old are you?
I'm 24.
Okay. And what is your occupation?
Currently, right now, I'm a third-year medical student here at USF.
Oh, wow. That's awesome. Do you have any medical problems I should be aware of?
Right now?
Mm-hmm.
I mean, have you ever heard of juvenile arthritis?
Yes.
When I was a kid, I was diagnosed with that. So every now and then I'll have flare-ups. I'll have to.
Okay. And do you take medications for those flare-ups?
When I have flare-ups, yeah, I'll try to take it every day.
To manage that. Okay. And do you take any other medications?
Yeah, I take an antihistamine too every day because I have, allergies from pollen and stuff. So I take that every day.
Okay, every day. And do you notice a change in your voice when you're taking your JR medication or allergy medication?
No, not that I notice. No.
Okay. Well, sometimes antihistamines every day can be damaging to your voice, and you might notice that it's better in the morning, and then it gets gradually worse towards the end of the day. Do you notice that at all?
I mean, yeah. I mean, it definitely gets worse throughout the day, but I don't think that's from the antihistamines. I think it's
right. Okay. Yeah, just some on and off symptoms in general. Have you ever had surgery?
When I was a kid, I had my tonsils removed.
Okay. And I know you use your voice professionally at work, but outside of work, have you ever used your voice professionally for singing or acting or anything like that?
I mean, I might sing in the shower every now and then, but no, I don't sing professionally, or only when I'm seeing patients or with attending.
Okay. When did you first start to notice the changes in your voice?
Well, I guess it's really been this year. I mean, I'm currently in my third year, and we're in the hospital and stuff for the first time, and I've really started to notice now, and especially, after like a really long, hard day where I'm, being told by my physicians, by my attendings to, run around and see this patient, see that patient, and I'll kind of notice towards like the end of the day, my voice doesn't feel normal or like it used, like it is in the beginning of the day, and I feel like I'm really like strained and stuff. And
okay, and what would you say your current symptoms are? Other than you said strain, you mentioned strain. Do you notice anything else?
Yeah, well, I feel like hoarse, like when I talk, especially like at the end of the day. Yeah, I just feel like it's very hoarse, or like it might like squeak every now and then, and it's really, I don't know. I feel like it's affecting my work. I feel like, when I'm presenting to attendings, and I don't feel as confident as as I sometimes do, and I feel like it's my voice, and I feel like it's affecting, how I present myself and how I'm seeing patients and stuff. So.
Right. Okay. Well, thank you for sharing that. That's very helpful information. And you definitely explained how you typically use your voice during the day, but on average, how many hours do you think you're using your voice while you're at the hospital?
Hours? Well, I guess it depends on where I'm at for the day. I mean, we do a lot of different rotations and stuff around Tampa. So if I'm doing surgery for the week or, the month, I'll be working nonstop. I'll be, 12, 14 hours easy.
Wow.
In the day, 6 days a week. So I use my voice a lot then, but maybe on other rotations, if I'm on like neuropsych or family med, it's more of like an 8 to 5 kind of thing.
Right now, does your voice sound like it usually does?
I mean, my voice sounds normal. I would say right now it's not really hoarse or anything that I notice.
And do people ask you to repeat?
Like repeat what I'm saying? I mean, I guess now that you say something, I see patients constantly throughout the day, and I'm always explaining, medical symptoms and disease process or medications, and sometimes it asks me to repeat myself, and I think it's just, maybe they don't understand
Mm-hmm.
their disease or what medications they're taking, but and I guess it could be that my voice is, making a weird sound or something, and they can't hear me. So.
Yeah, well, that could very well be possible. Do you use any strategies to help you be more easily understood?
I guess when they ask me to repeat myself, I think maybe I talk too fast or something, so I'll just try to, take a breath and slow down and, speak maybe more slowly or softly.
Those are good strategies. Um, has your voice caused you to talk any less than you typically would?
I would say no, just because I can't,
Mm-hmm.
when I'm at work, when I'm at the hospital, like I have to be presenting to physicians. I have to be seeing patients. I can't really take a break,
Right.
because my voice is, off or something like that. So,
And so you would say you don't rest your voice very often then either.
no, I mean I wish I could, but I can't.
Right. Okay. And do you ever run out of breath during speech?
No, I wouldn't say that's the problem.
Okay. Is it difficult for you to take a deep breath ever?
No.
Okay. Have you noticed if your voice is monotone in pitch?
I wouldn't say it's monotone, no.
Okay. And have you noticed if your speaking voice is higher and lower in pitch?
I mean, I guess sometimes I say like I squeak, or like I'll feel like it goes like really high for a second. So yeah.
Okay. And I think you mentioned this earlier, but does your voice feel fatigued at the end of the day?
Yeah, I mean, that's when I see it the most, is especially at the end of like a long, stressful day. It'll be, especially fatigued.
Right. Have you noticed any reducedness in loudness?
No, I mean, I've always been told that I'm a really loud person.
Mm-hmm.
I speak loudly. I speak with my hands, or but so in terms of being not as loud, I mean, I don't know.
Okay. Have you noticed any slurring or mumbling in your speech?
No.
Okay. Has the rate of your speech changed?
No.
And now I'm just going to ask you some vocal hygiene questions. Do you find yourself yelling a lot?
Not more than normal.
Okay. How often during a week you would say that you're yelling?
Yelling? I mean, I just talk loudly, so I would say, I guess I normally talk loudly, but I'm not yelling per se.
And you're talking frequently. How often a week are you talking a lot? Every day at work?
Oh, I mean, yeah.
Okay, almost all day long.
Yeah.
Okay. And do you notice any vocal strain when you're projecting your voice?
Vocal strain? What do you mean?
Does your voice feel strained when you're trying to project and talk a little bit louder?
I mean, yeah, it like feels weird.
Okay. And do you clear your throat a lot?
I mean, every now and then I guess I will.
Okay. And do you find yourself coughing a lot?
No, I don't really cough. I don't have a cough.
Okay. And do you experience any tenseness in your voice during work when you're speaking?
What do you mean by tense?
Like the muscles around your neck and your larynx, do they ever tense up?
I mean, not that I notice. They don't feel tight or anything.
Okay.
So.
Do you find yourself being overly enthusiastic or being really excited when you talk?
I mean, yeah, I told you that I talk loud, and so sometimes I might get a little excited about something and be exceptionally loud. But other than that.
Do you participate in any exhausting activities such as working out or weightlifting or cheering at a game or something?
I mean, yeah, I like to go to the gym and stuff, so I go to the gym a lot.
And do you lift weights at the gym?
Yeah, I like to lift weights.
Do you ever experience strain when you're lifting heavy weights?
like strain in my voice or like strain on my back or my.
Yes, in your voice and all over, but.
I mean, I guess sometimes you gotta force out a rep, so.
Right.
Yeah.
Okay, just be really careful when you're doing that because sometimes the strain in your voice when you're lifting heavy weights can be damaging to your vocal folds. So just make sure you're drinking a lot of water during and after lifting weights. And then the same goes for if you're ever throat clearing or coughing. You want to drink water afterwards.
All right. That's a good tip. Thank you.
You're welcome. And I know you're experiencing little sleep due to school and the nature of medical school, but how often would you say that that you're experiencing fatigue due to lack of sleep?
I mean, I feel like I don't sleep that much just because I have to be up and be in the hospital. So I don't really get that much sleep.
Okay. Do you work in a dry environment?
No.
Do you cry often?
No, I don't cry.
Okay. Do you have any unresolved emotional conflicts?
No.
Okay. Do you drink coffee?
Yeah, I drink a lot of coffee.
How often would you say?
I drink coffee. I mean, at least 3 times a day. Easy.
Okay. And do you smoke?
Tobacco?
Mm-hmm.
No, I don't smoke tobacco.
Okay. And do you drink alcohol?
Yeah, I mean, when I go out with friends on the weekend.
So socially.
Drink beer. I mean, yeah, you could call it that.
Yep. All right, well, that is the end of the client interview, and now we'll be moving on to the voice assessment.
All right, sounds good.